Stay Lit, A Prescription to Avoid Dr. Burnout, 2020, by Dr. J.W. Crosby, MD. Vacations are a great stress buster before, during, and in fond remembrance. Try to avoid needing a vacation after your vacation. Leave a day for travel at each end and leave plenty of time to get to the airport. Better yet, stay overnight at an airport hotel, where you can park for free and take a free shuttle bus over for the flight the next morning, thus avoiding traffic and weather delays. Don't plan anything the first or last day and avoid trying to do too much. Take half the clothes and twice the money. Sit down with your spouse the first day of the year. Block out in red on a calendar 8 weeks off and send copies to your friends, family, secretary, call group, and the hospital. Never let anyone encroach on this sacred time. The Tarzan Method. Just as Tarzan was always looking for his next vine as he swung through the jungle, you should plan your next vacation while on vacation. Support systems. If you have small children, consult a reputable nanny agency. Hire, pay, and treat well a good nanny. You can come home after a rough day and have happy kids, a meal on the table, and a clean house with the laundry done. It is well worth the money and is tax deductible. Isn't childcare as important as your $30,000 car? A female surgeon once said to me, "Women doctors need a wife, which equals a nanny. Male doctors have been doing this for centuries." Young kids. A young family doctor and mom shared these tips with me. A housekeeper is essential. Why waste valuable time at home scrubbing toilets? My time is worth more than that. Dinner preparation. The busiest time of day is supper time, the arsenic hour. So take one day every 2 months and cook from 9 to 5, preparing 16 dinners. Put them into Ziploc bags and then into the freezer. It really pays off for those busy nights to just reheat in the microwave. Also, on occasion, this FP goes to Supperworks for 2 hours with her husband, or alone, where they assemble a dozen meals for the freezer. She says they get a glass of wine and it's quite fun. Go online to www.supperworks.com for healthy meals from scratch. She also books an emergency catch-up day, which are a few hours on the last Thursday of each month for rescheduling appointments. That way, if she has to cancel due to child issues, she can open up that block on short notice to rebook physical and things that are hard to fit in. Most of the time she doesn't use it, and when that day rolls around, she has a few hours to catch up on paperwork or to go to a spa. She abandons her charts when done at the office, goes home to her family, and finishes up on her laptop with remote access after the child's bedtime. She takes a day off once a week and spends it with her child. Girls or boys night out. She also prescribes personal time for fun. She gets together for drinks with a few friends to chat and forget about work and home responsibilities for a couple of hours. It's hard to squeeze in, but worth it. Take yourself on a date. Try going out for a few hours a week all by yourself, trying new things, and do what you really want to do, be it a film, library, art show, or museum. One old GP in our town used to love to go to the horse races. A year in my life. So let's look at how I put this time and stress management advice all together for my family practice and myself. You will be different from me and change your practice of medicine at different times in your career, but you can learn from my 44 years of mistakes and triumphs. Sunday night. I go to sleep at 10 p.m. so I can wake up refreshed without an alarm clock on Monday at 6 a.m. I brush my teeth, shave, and drink an instant breakfast so I am not hungry and eating donuts and muffins full of sugar at 10 a.m. I have a decaf coffee and read the newspaper. I then drive to the YMCA and swim links for 30 minutes. I have a whirlpool bath, sauna, and shower, and then drive to the hospital. I do my paper and computer work in the doctor's lounge from 8 a.m. to 8:50 a.m. and have time to chat with other doctors. Group therapy. I then leave time to get to my first nursing home on time at 9 a.m. Never go at meal times. If I am late, I get stressed and it sends the message that everyone can be late. I see all the patients the nurse needs me to, then do my charting and computer work, labs, and imaging with the nurse. For family meetings, I am on duty for the first 10 minutes, then leave. The nurse tells everyone to stick to medical matters, so my time is not wasted hearing about the food or plumbing. I then drive to my next nursing home and do the same until noon. I take off from noon until 1 p.m. for lunch, which is a nice break. I can go to meetings at this time and not lose time from my office. At 1 p.m., I review my lab, imaging, and consult letters in the computer at my office. At 1:30 p.m., I start to see patients. On Monday, the afternoon has been left empty except for same-day call-in appointments. Therefore, I love Mondays because it is little, easy cases. The patients love it because they can get in on the phone line and be seen on time the same day. If you have long waits, the patients will tie up your secretary by arguing with her to get in early and may exaggerate their symptoms. Time managing the top 12 diagnoses. 1. High blood pressure. I have a stamp in the computer that has all the history and physical in an SOAP, S subjective, O objective, A assessment, and P plan format. I ask the patient how they are doing and if they have any ankle swelling, shortness of breath, or chest pain. I ask about lightheadedness or headaches. I then do their blood pressure, listen to their chest and heart, and check peripheral pulses and ankles for edema. If normal, I remind them why we do blood pressure to prevent stroke and heart attacks, and that they can't feel it when it is high. I see them in 6 months and give them a handout in the computer to reinforce my teachings. I print a lab slip on my secretary's computer, exit strategy, and type on it, back in 6 months, so I don't have to interrupt her. 2. Arthritis. With anyone with a painful joint, I get a history and examine it. I do an x-ray if I suspect osteoarthritis, and wait until they return a week later to go over the x-ray with them and then advise the patient on medications, physio, bracing, and ice. I have a handout and refer to physio with a consult letter function on my computer. It includes my history, physical, and the x-ray results. I refer to an orthopod early if it looks surgical. 3. URI or upper respiratory infection. I use a computer template that asks how long they have had it, if they have a cough, sputum, ear pain, or a temp. I then examine their ears, nose, and throat, palpate their neck for lymph node enlargement, take their temperature, and listen to their chest. If it is viral, I explain that antibiotics are not only useless, but also harmful as they may cause allergies, diarrhea, or superbugs. I have a handout in the computer on why they didn't get an antibiotic. If they need an antibiotic, I have a prescription function on my computer that writes it out. Also, there's an off work letter writer on the computer. 4. Abdominal pain. I have a template that prompts me to ask what caused the pain, where the pain is, its quality and duration, what helps it and makes it worse, and what they have tried as a home remedy. I then take their temperature, check ears, nose, and throat, listen to their lungs and palpate, and auscultate their chest and abdomen. I do a rectal if needed. I can order imaging by computer. If they need stat help, I can write a consult letter to the emergency physician. 5. Depression. I have a stamp in my computer that prompts me to ask about the 9 symptoms, which are you tired? Do you wake in the middle of the night? Are you crying? Do you blame yourself and feel guilty? Do you lack concentration? Do you lack joy in things you used to love? Has your weight gone up or down unintentionally? Are you faster or slower than others? And are you suicidal? If suicidal, I get immediate help. Otherwise, I give them my handout on depression and ask them to read it and set them up for counseling. I have them back in a week to go over the handout. 6. Prenatal. I use the Ontario prenatal forms and get my secretary, delegate, to find out as much as she can, then go over it with the patient for accuracy. I do the physical the next visit. I tell the patient to read the book, What to Expect When You Are Expecting. I leave the pelvic exam for the obstetrician or midwife to avoid double discomfort. 7. Well baby care. I use the Rourke baby scale in my computer for every visit. It is really good and helps you remember all the milestones and tips. I always talk to the patients before examining the baby to avoid having to shout over the crying. I always compliment the parents and tell them to never hesitate to call for advice, which we have 24/7, 365 through our Ontario telehealth service and my office. 8. Diabetes. I use a stamp and check feet and eyes. They have their shoes and socks off before I see them, and bring their list of sugars since the last appointment. We go over their lab and how they are doing, then I examine their heart, lungs, peripheral pulses, skin, and blood pressure. I weigh them as I am talking to them. If stable, I bring them back every 6 months. My secretary gives them a lab slip signed by me to do blood sugars, HbA1c, creatinine, urine for protein, lights, CK, liver profile, and lipids 1 week before each visit. I send them to diabetic daycare with their spouse to learn about diet and exercise and how to handle their disease. 9. Urinary tract infection. I use a stamp that asks how long they have had symptoms, do they have frequency and burning, do they have any temperature or flank pain. I examine their abdomen and take their temperature, and if it is a simple UTI, I do a urinalysis routine and micro and culture and sensitivity, and if the results can't be back in a reasonable time, I start an antibiotic. 10. COPD. I ask about sputum change and shortness of breath. I inquire raise smoking and encourage them to stop and try medications to help with this. I examine their chest and ENT. I refer them to the COPD clinic and give them an antibiotic to take if they get a URI. I encourage them to get a flu and pneumonia shot. 11. Physicals. I do one every 3 years on healthy, symptomless patients. I give them my oceanwave.ca tablet, which does the functional inquiry wirelessly. I can see other patients while they are filling it out. It is more thorough than I am, and the patients will answer more truthfully. I weigh the patient and do their height and blood pressure. With women, I bring my secretary in to chaperone breast and pelvic exams. I do lab for complete blood count, lights, blood sugar, cholesterol, and stool for occult blood. In women over 50, I do a mammogram every 3 years and bone density every 3 years. 12. Hypercholesterolemia. I have a stamp for this too and go over their labs and meds. I do their BP and examine their heart, lungs, and peripheral pulses. I ask about muscle aches and if stable, see them in 6 months and do a lipid profile, creatinine, BS, lights, CK, and liver profile. The last patient is usually at 4 p.m. I visit with my wife from 5 p.m. to 6 p.m. and unwind from the day by reading the mail. I complain for 10 minutes, then move on to non-medical fun stuff. We avoid wine until the weekend. This saves money and my liver. We eat at 6 p.m., then read until 9 p.m., then watch trash TV. No news, it's always bad and stressful. Until 10 p.m., then go to sleep, so I get 8 great hours. Tuesday is the same as Monday, but with booked patients like people with cholesterol, blood pressure, and diabetes issues. Also, we see well babies and do prenatal visits. Wednesday. I do my office in the morning from 9 a.m. to noon. We put in physicals and counseling here that I haven't been able to delegate to social workers or psychologists. This is a good time to do these things because I am fresh, not rushed, and not tired. At noon, I am off for the rest of the day. I do non-medical stuff. No paperwork, it has been done every morning. And no emails, it has been done every day after lunch. I sign out to another doctor or nurse practitioner and reciprocate. I turn off my iPhone. I read, non-medical, nap, garden, walk, cross-country ski, meditate, do nothing or anything my heart desires. If I have my once-a-month after-hours clinic, I do it on Wednesday evening from 5 p.m. to 8 p.m. to avoid a long day. Thursday is like Tuesday. I call it TGIT, or Thank Goodness It Is Thursday, as my weekend starts at 5 p.m. For you younger doctors that still have to work harder, you can work Friday like a Tuesday. I do errands and chores on Friday, and I'm really off on Saturday and Sunday and can do anything. I sign out my practice on Wednesday afternoon and Friday to 2 family physicians to avoid burning them out, and I reciprocate. I help my secretary avoid burnout because she gets every Friday to work, not bothered by patients, the phones, fax, text, and email to get caught up before the new week begins. Vacations are the reason we work. I book 8 weeks off per year and get them paid for by being in an FHO, or Family Health Organization. This is an Ontario system of rostering patients. The taxpayer gets a break because we cover each other for free. We can do this because we only get 3 extra patients with easy problems per day. The rest can wait until their own doctor returns for problems like routine checkups, lab, and BP monitoring. I have a nurse practitioner cover my office and nursing homes when I am off for 2 weeks or longer at a time. My wife and I sit down with the calendar every January 1st and book our 8 weeks. We send the list to everyone in our lives. We take a week in February, just the 2 of us, go for skiing or go south. We use Avion points to fly. We pay our credit card off before 30 days to avoid 20% interest, which is very stressful. In March, we go away with the kids on March break. You can drive to good Quebec or New York or Ontario skiing. In July, we go to the cottage alone for 2 weeks. The kids are at camp, which provides them with a paying job and room and board as counselors when they get older. In August, the kids and their friends and significant others and our grandson join us for the last 2 weeks of summer at the cottage. In November, we go to a conference in a big Canadian city with great shopping, restaurants, and live theater. Or we take in a continuing medical education cruise. I take a week off between Christmas and New Year's. I am on my cell phone for 4 doctors, but get about 3 calls a day so everyone thinks I am wonderful. I take the Monday off at the end of my vacation to come to the office alone to get caught up on paperwork and computer work before work starts the next day. In summary, it is almost impossible to change your personality, but much easier to change your circumstances. You need to write down everything that stresses you out and, with the help of friends, family, and a mentor, work to change the process.